A quick summary on the effectiveness of exercise therapy compared to joint manipulation for the treatment of SI joint pain. What this study found was that manipulation was more effective in the short term, so at 6 weeks, in reducing pain and improving function. However, at 12 weeks, the exercise group was more effective for both pain and function. And then at the follow-up of 24 weeks, there are no difference between the groups. Let's take a more in-depth look of the study. So this study was by Najati, and it was published in Pain Physician, and it was a randomized controlled trial with 3 different treatment groups. There was the exercise group, the manipulation group, and then an exercise plus manipulation group. And in each one of those categories, there were 17 individuals that were included. For the exercise group, they met with the physician once per week for 12 weeks to go over the exercises, and the exercise program itself had a couple of different components to it. The first one was a self-mobilization exercise where they would lay on their back and they would pull their knee up towards their chest. So the idea was that they were mobilizing that SI joint. Then they would also do a sacroiliac stretch. And so basically they would lay on their back and they would pull their top leg over and across and then rotate away from that side. And then they would do some sort of contract relax with the provider where they were pushing their foot or their leg up into the physician's hand for a given amount of time and then relaxing. So kind of stretching those glute muscles is what it seems like they were attempting to do. And then there was a spinal stabilization program, which itself was divided into 4 different categories, I think with the idea of each progression getting a little bit harder. Basically, in summary, those exercises were a lot of abdominal hollowing exercises, and then a couple of planks and side planks just for some core stability. In the manipulation group, they did 2 different maneuvers. There was one that was more of just like a mobilization, so the patient was laying on their back and the provider moved their leg around, trying to induce some movement in that SI joint. And then they also did a high velocity, low amplitude manipulation of the SI joint, again trying to induce movement in that SI joint. The treatment structure was that they would do these 2 maneuvers, retest with either Gillet's test or a standing forward bend test. And then if there was still pain, then they would repeat the manipulation again. It wasn't quite clear at the end because they said that if there was still a positive result, so they had pain with either of those maneuvers, that the patient was excluded. And I don't know if that was actually excluding them from the trial completely or just that was the end of the session. From the follow-up numbers, it doesn't seem like anybody actually was excluded, so I was a little bit unclear what that actually meant. It was also unclear how many treatments of manual therapy these patients received. It sounds like they might have only received 1 session of manipulation and then followed up at 6 weeks, 12 weeks, and then 24 weeks. However, it wasn't quite clear if that was actually the case in this study. And then the manipulation plus exercise group was really just a combination of these 2 other groups. So they performed the same exercises as the exercise only group, and then they also had a session of manual therapy as well at the start of the program. The study found that the manipulation group had superior pain relief as well as improvements in function, which was measured by an Oswestry as well as a Roland Morris questionnaire at 6 weeks compared to the exercise group as well as the exercise plus manipulation group. However, at 12 weeks, the study found that the exercise group and the exercise plus manipulation group were superior in both pain relief and function compared to the manual therapy group. However, at the 24-week follow-up, there was no significant difference between any of the 3 groups. And the results of this study are pretty fascinating, and especially when we dig into some of the details. So when we look at manipulation, the manipulation group had the greatest improvement in both pain relief as well as function in the first 6 weeks. And this was even in comparison to the group that had manipulation with it in addition to exercise. And that's surprising because we'd expect that if both groups contain manipulation, that they'd both see that same improvement around the 6 weeks. And so the question is what was the effect of exercise in that group? Why did it seem to actually dampen the pain relief as well as the improvement in function? Was it the exercises specifically, or was it just exercise in general? It's a little bit fascinating to kind of see what that difference is, although we don't really know what the answer is. And when we look at the follow-up period from 12 weeks to 24 weeks, when there was no treatment provided in any of the treatment groups, there was a tendency for the pain to increase and the function to decrease in all of the groups. And so while we had short-term improvements in that 3 months when treatment was being delivered, is it only short-term improvements? Does this actual tendency of the pain increasing and the function decreasing just kind of go back to baseline with a longer-term follow-up? One of the limitations of this study, which they mentioned, was that there was a lack of longer-term follow-up. And so it would be interesting to see is if these treatments are only providing that short-term pain relief and improvements in function when they're actually being administered, or if they're able to actually provide some sort of long-term solution. And there's just a lot of variables that we don't know in the treatment of low back pain that this study kind of touches on a little bit. So for one, when we look at the exercise program that they used in this study, we don't know if that's the best exercise program that we should be using. Are there different exercises? Were the loads right? Frequency, duration, all these things we don't know. For manipulation, well, I guess first we got to know if there was just one manipulation session that was delivered in this study, but was one sufficient? Do they do better with 2 or 3 or a more consistent treatment schedule? Same thing with the exercise group. Was 3 months enough to actually make a change? What if they actually continued that exercise program up to 6 months? How does that kind of affect the longer term outcomes? Because inevitably, short-term pain relief and improvements in function are great, but if they're only going to be for a couple of weeks and then it's just going to gradually return, then we kind of need to reassess and figure out, well, what's causing the SI joint pain first of all, but then also what are the more effective long-term solutions that we should be using.